and then put a vote next to that question so that we'll know that a lot of people have that question. So we're going to go through and prioritize the questions that we see the most likes for. And that way we can keep the chat box fairly clear and make sure that we get to the questions that are burning on most people's mind. If a question is not exactly your scenario, but it's close, I would still encourage you to go ahead and put a mark next to that question so we know that we're close. And I do believe that there is an option within the question to add a little bit of additional information if your question just has a slight difference to it. But just go ahead and place your votes so we can see where everybody's questions are lying. Okay, so today we are going to be, today we're going to spend our time on two topics. The first topic that we want to review and answer questions about is vaccines, because we know that with the vaccine rollout on Monday that there are a lot of burning questions out there. So we're hoping that we're going to be able to really clear up the questions that are out there and get you some clear guidance on that. After vaccines, assuming that there's still time left, we're going to take time to review the amendments that were in the January 12th guidelines that we did not get through 2 weeks ago. And actually, I think that section will go pretty quickly. So we're going to jump in today and talk on vaccines. So first, we're going to start out and just review some points that we think are helpful for you to know, and also address some of the questions that we've already been getting. So we did send out a communication on Monday evening, and this is information that was covered in that communication. So what you need to know is the vaccines are free. They're free to everyone. You do not need to have any health insurance in order to access the vaccines. You don't have to show proof that you're an early learning provider, but you may be asked by the individual county to declare that in some manner, but you don't have to show up like with your license number or your registry number. In the letter that we emailed on Friday, we did include a link to an attestation form that you could use with your programs or with your family childcare, with your staff or your family members. If you think that would be helpful, you can fill out that form for them declaring who all is connected to your childcare that should be getting the vaccine. But from what we understand, the counties are not supposed to be asking for proof, but we did provide that form just in case you want to have a little further assurance. After you get the vaccine done, you're going to receive a vaccination card or a printout verifying that you had the vaccine. And you have to get 2 doses of the vaccine appropriately spaced before you can be considered vaccinated. And I'm going to ask my panelists if they have anything they want to add to this before I move on. Nothing at this time? Okay. So who qualifies for the vaccine? And I hope that the letter we sent really clarified this question. So when we talk about who qualifies to get the vaccine in Group 1B, those are for licensed and recorded emergency childcare providers. And when we talk about licensed and recorded and you're an in-home provider, this includes all your staff that work for you, as well as family members in your home that are having contact with childcare or part of the childcare. And that can go down to your teenagers that are age 16 and over. And the reason why we specify age 16 and over is because right now the vaccines are not usable for children under 16. So that's why that clarification is made there. And these are for, like I said, like for individuals who have contact with childcare children. If you're an unlicensed ECC, you also are qualifying to receive the vaccine right now. And also we want to offer the vaccine for licensed programs and reported programs that are not non-ECC, meaning they're not operating right now. And the reasoning behind this is that what we're hopeful for is that if you go out and get the vaccine, then you'll be ready to open up your childcare and get approved as an ECC, because we're really wanting to build that capacity across the state. And then ODHS is Oregon Department of Human Services. So ODHS, family, friend, and neighbor caregivers, and within the Office of Child Care, we call those regulated subsidy providers. Those providers are also eligible to get the vaccine for themselves. So who does not qualify? So there are some exempt providers that do not qualify to go get the vaccine right now. what we call kind of an informal care situation that is caring for less than 3 children. They're not required to be licensed through Office of Child Care, and they're not caring for ERDC or subsidy children that are on ODHS. Those providers are not qualified at this point to get it. And then parent cooperatives that are not a recorded program or an emergency childcare are also not qualified at this time to get the vaccine. And that doesn't mean that those providers won't come at a later phase. They're just not in this current phase. So one thing to talk about, and I think that Dr. Thomas and Dr. Lyon could probably speak more to this, is that the administration of the vaccine or the distribution of the vaccine is being done by the counties. And so the county should be reaching out to child care programs to advise them when it's time to schedule for a vaccine. And I know we do have a slide on this in a couple slides that is going to, oh goodness sakes, I need to change my slide deck. Hold on real quick, everyone. Sorry about this. I just noticed that I have yesterday's version that didn't have the slide that you needed next. Sorry about this. I was so sure tonight was going to go off without a hitch.
People can be rest assured that they're getting the freshest data.
Right. And Dr. Thomas made a new slide that had information about where to get the vaccines, and I want to make sure that that is the slide that I show you. Almost there. And of course, when you want your computer to go fast, it spins and it spins.
Yeah.
Oh, for goodness sakes, it's been opening up all day with no problems.
Tammy, while we're waiting, do we want to take a couple questions?
Yeah, that would be great. Mary. Thank you.
Okay, that'd be wonderful. So I've got a few where we've got a lot of thumbs up, so I'm going to start there. There is a lot of thumbs up on, can I require my employees to get vaccinated?
In general, at this point in time, OHA is not requiring anyone to get a vaccine. However, it's up to, it's like the slide, but it's up to, you would need to, it's sort of a decision up to your business if you want to pursue that. You would have to check with what we call BOLI, which is the BOLI, the Bureau of Labor and Industry, to find out whether it's acceptable for your business to require that for employees.
And I have one more, if you don't mind, that just kind of goes with it. Somebody said they have an employee who doesn't feel comfortable getting the vaccine, but she continues to get questions from parents asking if she's gotten her immunization yet. Is she protected by HIPAA, or do we need to tell families who is immunized and who is not?
I think she's protected by HIPAA, and she is can say that I don't feel comfortable discussing that with you, and as an employer, you don't have the right to disclose that about your staff.
Great, thank you.
Great. So how do I find out where to get a vaccine? Dr. Thomas, would you like to talk about, or actually Miriam, you would also be a great source of info for this slide.
Sure. Dr. Thomas, do you want to go first, or?
Oh, sure. It depends on where you live, essentially. So if you're in the Portland area, in Clackamas, Multnomah, or Washington County, you could go to our website that's listed here, and there's a chat box. So if you go onto the page and you go down towards the bottom on the right, there's kind of like this little thing that looks like an envelope, and you click on that, and you go through a series of questions that ask you, like if you're in one of the risk groups, so of course you would say child care provider, and then it pops up, you know, with information about where you schedule the vaccine. And we do want to say that at least the way it was working on Monday, kind of anyone could say that they were in the group and get through. I mean, the chat box can't rule out that you aren't someone else. So I think in some cases, people have been tempted to say, oh yes, I'm a teacher, and go on and sign up for the vaccine. And we just want to remind you that if you do that, there's not going to be enough for all of the real teachers and childcare providers. So we expect you to just sign up for yourselves. The other issue that I've heard recently is that the chat box will only work for 1,000 people at a time. And there are more than 1,000 people who want to use this chat box to sign up. So it occasionally gets overloaded, and so you might have to keep trying to get it to work. So the technology is good, but it's not perfect yet. For the rest of the state, it's really organized by the county health department. And so we're doing a number of things, and Miriam can tell you more about this, ways of sort of, providing lists of providers to the county health departments and so forth. But the best thing is to go to your local public health website, or look on the ELD website and Facebook, and they'll be, we'll be trying to update it on the Facebook page. And do you have more information about that, Miriam?
Yeah, absolutely. Thanks for that, Dr. Thomas. I mean, I think, yeah, the message here is there's a tri-county strategy, and that is what Dr. Thomas just referred to with the chatbot, and then there's the rest of the state, and that really this is being driven kind of county by county, and so it's going to look different. For example, some counties we know have already started maybe vaccinating educators and providers prior to Monday. Some counties may still be working through priority group 1A. Other counties may be relying on a lot of, kind of local news and sort of word of mouth. I know we've been hearing a lot that counties are public health are really starting to connect with their R&Rs and are working through some of that outreach. And so I think just a couple takeaways here. One is for the rest of the state, as Dr. Thomas was saying, these resources are really critical. I'm so sorry about that. These are great ways. Locally, you might be hearing about local vaccination events and how to schedule before we do at the state or even OHA. We're going to try to monitor that. There is this website that is going to aggregate a lot of the information, but it's really county by county. And then again, the tri-county area, the vaccine providers are all utilizing this kind of centralized chatbot system. I do understand that they're working quickly to have that at least available in Spanish. And I know that as of earlier today, so that you can do the chatbot at least in English and Spanish, and that they were working on today to open up some more appointments. And I think to just emphasize also what Dr. Ann Thomas said, you can be signing up for yourself, for your household members that are linked to your facility. You can be scheduling for your staff or helping them get the information to schedule. But if you share that really outside of your program, right, the more that these go viral, this chat box, you'll see we're not putting that on social media, et cetera, the more access other people have outside of those in this priority area group. And so again, that is very specific to the Tri-County area.
This is Dr. Lyon jumping in here. I'd like to go back to that question about the staff member that didn't want to get vaccinated. This will only work to snuff out COVID if people believe and kind of trust in us in the immunizations, and especially the folks that have contact and a lot of contact with the general public. It's so important that they don't become spreaders or what we call vectors within their own community. And I realize that, persons for one reason or another might not have complete trust in the medical system or new vaccines and all. And I would just encourage them to give us a chance, give us a chance to explain to them why it's a good vaccine, why it's safe. Hook them up, through OHA with ourselves as the senior health advisors, or the health system where they get their general health care, or their local county health department. But it's important that we all wear masks and we all do the social distancing thing. It's important that when it's available to us all, it would be best if we are all comfortable and get vaccinated. I will be. when it comes my turn. I've got to wait. I'd go there right now if they let me, but they're going to make me wait a few months.
So thank you for that. So our next few slides are also going to walk through a lot of those common questions that we've been receiving. Both our doctors on the line can help us through these. So why should I get a vaccine? Can one of you take that one?
Sure. I mean, at this point, it's really the safest and most effective and reliable way to prevent infection with COVID-19. Now, it's going to take time for the whole country to get vaccinated. So we still need to do a combination of things. So people who are eligible for the vaccine, we really hope they'll take advantage of it. But we still need to keep wearing the face coverings and staying 6 feet apart and washing our hands and avoiding large gatherings. But really, if we can get enough people immune to COVID-19 by getting the vaccine, that's really going to be the thing that's going to reduce spread in the community. I mean, right now, when things get bad, we go into stay at home and that works. But then as soon as we come out again, the virus comes back. So, vaccine is right now is the best thing we have to keep that from happening again and again.
Great, thank you. So we talked about this already, about whether or not the vaccine is safe. Would you like to share a few more points on this?
Sure. In general, I mean, this has been like unprecedented. We've never had a new vaccine come out so fast. And it's because there's really been a tremendous commitment by, our government and governments around the world to, fund the scientists and the vaccine companies to develop these new vaccines. And the two that are now currently used in Oregon, that have been licensed in Oregon, and it'll be the ones that you are now eligible to get, have been tested on tens of thousands of people, including here in Oregon. And they've really done a good job of making sure that they tested the vaccine on people from all different backgrounds and ages and communities of color. There are two federal agencies that oversee vaccine licensing. There's the Centers for Disease Control, and there's the Food and Drug Administration. Both of them have committees that review all of the drug company data, including all the safety data, to make sure that it works well and that it's safe. And in general, we know from history, the history of other vaccines, that if people are going to have a side effect, it's usually in the first month or two. So the companies that were making the new vaccines were required, when they were testing it, to give it to people and follow up very closely with those people for 2 months after vaccination, because that's when most people have side effects. So it really has passed, although it seems like, gosh, they've only worked on it for a year, and most vaccines take longer. The companies have taken all the safety steps that is normally required for vaccines, and the process by which the government, the CDC and the Food and Drug Administration, make their decision to approve it or not. They followed all the same rules that they always follow.
Well, speaking of side effects, we've heard about there are some times when we get the vaccine and we start experiencing some COVID-19 symptoms. Can you talk us through that a little bit?
Sure. So in some cases, there is some overlap between the symptoms of COVID and the symptoms of just having a reaction to the vaccine. So, and when I say vaccine reaction, these are the most common things that happen in like the first day or two after you get the vaccine. And so the circle on the left has the symptoms that are most likely due to a vaccine. So having kind of fatigue or fever or chills, muscle ache, a joint pain, or particularly pain or redness at the injection site, that's most likely to be due to the vaccine. And it doesn't mean that you have COVID. Now in the middle is fever, and that could either be a vaccine reaction or it could be part of COVID, because as you know, when we screen our staff and our children to see if they have COVID, fever is one of the things we look for. But then the other things that we use to screen for COVID, the cough, shortness of breath, the loss of sense or taste of smell, that is really not part of getting the vaccine. That means that probably you were around someone who had COVID 5 or 6 days ago, or maybe even a week or two ago, and that now you're getting COVID, and it's just bad luck that that you got these symptoms at the same time that you got the vaccine. These are not the ones on the right, the cough or shortness of breath. That's not from getting the vaccine, because the vaccine doesn't actually give you the disease. So these are it. So sometimes it can kind of be hard to sort out. It's like, well, do I have COVID or do I have a vaccine? Can I work? So if we start about looking at the circle on the left that has the number 1 on it, the fatigue or the chills or the redness, your arm is sore. If you don't have any fever and if you feel good enough to work, it's okay to go to work. You aren't going to give anyone COVID. If you do have a fever though, it's hard to rule out that you don't have COVID, and then it's probably still most likely the vaccine reaction, because it's very common to have a vaccine reaction and have some fever. But so we would say if you do have a fever, stay at home until the fever gets better. And particularly if you only have the fever, stay at home until the fever gets better. But if you're not better in about 2 days, then you probably should try and see a healthcare provider and think about getting tested. On the other hand, if you have those symptoms on the right side, the cough, the shortness of breath, loss of sense of taste or smell, that's more likely to be from COVID. So you would almost basically need to treat this as like when you do your normal screening for anyone, whether they've had a vaccine or not. If they have these, fever, cough, shortness of breath, loss of sense of taste or smell, they should stay home and they should probably get tested. Now, if they don't have a test done or the test is positive, then it's like having COVID, because the vaccine doesn't protect you. It takes longer than 2 or 3 days. So if you were exposed last week and then you get a shot, the shot doesn't help you. So if you have these symptoms and you test positive, you still have to stay home for 10 days, like we normally say for someone who has COVID. But if you do get a test, if you do have these symptoms and you get a test and it's negative, you could come back. I think the other thing that might come up is if someone is having these symptoms and they were exposed, like, so for instance, you were exposed to someone at work last week and you're staying home because you're in quarantine and you go get the shot. It kind of doesn't matter what happens to you. Like, you don't get to come out of quarantine. You would still, while you're trying to figure out whether you have a vaccine reaction to COVID, if you're in quarantine, you need to stay there and until this gets sorted out. Should we take more questions about that or keep going?
Yeah, Catherine, is there anything specific to this slide?
Let's see. Yeah, let me see. There's a lot about vaccine safety.
Okay.
Well, we can go ahead and go back to those.
Okay. So we've got 2 that rise to the top. Are you sure the vaccine's safe?
Mm-hmm.
And if somebody has taken it, did they have a reaction to it? And then a lot of questions about scheduling the second round of vaccine. Do you do that at the same time you get the first vaccine?
Okay, so for the first ones, I mean, as for the safety, it's really been tested. I mean, really the same as all the other, vaccines that are routinely recommended. People probably have heard about something called anaphylaxis, which is like an immediate reaction where people have trouble. They might get a rash, they might have trouble breathing, they might feel their heart rate go fast. That is very rare. For every 1 million people who get the vaccine, we see that like 4 or 5 times out of 1 million. And all the anyone who is giving the COVID vaccine is required to be prepared to treat anaphylaxis. And although this has happened a few times in Oregon and in the rest of the United States, everyone has been successfully treated. We haven't had any deaths from this anaphylaxis. And for the most part, people don't even have to go to the hospital. They can just be watched like at the vaccination place where they're getting their vaccine. They'll usually ask you to stay for at least 15 minutes so they can watch you. If you've ever had any kind of vaccine reaction, they will probably want to watch you a little bit longer, up to half an hour, to make sure that you're safe. But they will have the staff and the medications that are used to treat this anaphylaxis. But in general, we think it's really as safe as all of the other vaccines that we routinely recommend.
Thanks. There's a follow-up question. Basically, this is, could there be bad side effects down the road? What do the doctors think about this?
That
I
we
can-
don't know much about. I mean, in general, people, we know of all the reactions, at least the common reactions that can happen in the first 2 months. We don't know about, at this point, since the vaccine is new, we don't have any data on after that. But the fact that it was so safe during the drug trials, when the scientists were testing it, makes us feel that it should be pretty safe.
Thanks. I've got a couple too about, one is somebody who'd asked if it's safe basically for breastfeeding moms, and another one who'd said they'd heard pregnant women can't get the vaccine, and since vaccines are limited, would they be able to get some sort of priority down the road?
I think at this point, let's see, in terms of the pregnancy, there are limited data, but we think it's safe. And I know that many pregnant healthcare workers have been receiving the vaccine. Dr. Lyon, do you have any more information about pregnancy and getting the vaccine?
Yeah, I think they say there's no contraindication. If you have concerns, you should discuss it with your healthcare provider. They have, papers have been published about how women that are pregnant, when they get COVID, they can get pretty sick. So for the sake of the mother and the baby, we're not discouraging immunization during pregnancy.
And then there was another part of that question, Catherine?
It was, let's see, breastfeeding and pregnant.
Okay, breastfeeding, it's fine to keep breastfeeding.
Great, thank you. And another one actually just that came from Facebook was that they had employees that had taken that have gotten their first shots, but that they've heard that they tend to get sicker and react after the second shot. And, could you address that?
I have a good response for this one. This is a super common question in all of our community webinars. You can think about the first shot as someone kind of poking you in the shoulder with their finger saying, pay attention. That's what the first shot of the vaccine is doing. It's getting your immune system to pay attention to something new and different and foreign. The second shot is kind of like the call to, it's like getting punched in the shoulder saying, not only pay attention, but you got to be ready to respond. So it gets the body's immune system kind of geared up and ready. So when COVID they get exposed to COVID, that the immune system is immediately prepared to jump on it and prevent it from getting a hold and causing a significant infection.
Thanks. All right, Tammy, I'll probably let you move on. I mean, there's a lot of questions, but let's.
Yeah, some of them might be answered.
Yeah, that's what I'm thinking.
Okay.
And the next one we touched on a little bit, Dr. Thomas, but I want to, make sure we really talk about this, about wearing a face covering once you're vaccinated.
Sure. Again, it's a matter of, at this point, we don't know. When they tested the vaccine, they found that people who have had the vaccine are not likely to get COVID-19, or they're not sick enough to show symptoms. They're not having the coughing or the fever. But we do know that there are people who have COVID-19 who don't show any symptoms, but can still spread it to others. So we're not 100% sure that even though you aren't, you had the vaccine, you're feeling fine, it might be that you have a very mild case and you don't have any symptoms, but you could spread it to other people. So in general, we're still asking people who have been vaccinated, particularly in healthcare settings or high-risk settings like the long-term care facilities, to keep wearing the face covering. And the fact is, the COVID is still going to be around for a while until, most of us have been vaccinated. So it's still going to be circulating, and it's the best way to really prevent disease from spreading, to keep wearing the face covering.
Great. Okay, so now we're going to pretend like we've gotten both of our doses, and we're 2 weeks past having both of our doses. So now we should be vaccinated, but we're starting to experience some COVID-like symptoms. Do we need to be excluded if we're getting those symptoms after being vaccinated?
Yes, although it's rare to get COVID after you've had both doses of the vaccine and 2 weeks have passed by, because that's how long it really takes to take effect. The numbers you'll hear is that it's 95% effective. And what that means is that for every 100 people who get it, 95 will develop a good antibody response. They'll be immune and they won't get it. But some people, it just doesn't work as well. So although it's rare, there will be some people that might still get COVID. So if you have the COVID-like symptoms, and again, we're talking about the fever, cough, shortness of breath, the loss of sense of taste or smell, you should just sort of treat them as you would anybody, whether they're vaccinated or not. If they have those symptoms, they would need to leave leave work, or for a child, they would need to be sent home. They can go get tested, and if it's negative, they can come back, just like we always have said. But if they do test positive, or if they're not able to get a test, they would need to be in isolation for the full 10 days and wait until they've been better without a fever for 24 hours before they come back.
Okay. So now we've got the scenario that we've got a vaccinated person and they're exposed to a confirmed case of COVID. Do they need to quarantine if they are a vaccinated individual?
No, this is good news. We think, although we know that the vaccine isn't perfect, it's good enough that if you have just been exposed to someone, we are willing to say, okay, you're probably protected and you don't have to miss work, or your child doesn't have to stay home from school. You can still, go about your business. However, we still want you to be paying attention to your symptoms, because if the whole purpose of the quarantine is for 14 days. That's the time period that, if I'm exposed on January 1st, it might take until January 14th before I get the symptoms. So I'm still okay to go to work. I don't have to stay home, but I need to be monitoring myself. It's like, if I have a fever, if I'm not feeling well, if I start having a cough, then I would have to think, oh, maybe I did get COVID, and get tested and really stay home.
Okay, Catherine, what additional questions do we have about vaccines?
Oh, let's see. We have a whole lot about scheduling their second vaccine shot. Do they schedule that at the time of the first round? So I'll let you answer that one first.
As far as I know, they will probably not be scheduling it at the same time, but you will be getting reminders in the mail. You will be reminded. The state tracks these and will kind of send out reminders depending on which vaccine. The Pfizer vaccine, you have to get your second dose in 3 weeks. The other one is 4 weeks. So usually you'll get a reminder. And also, I don't know if the ELD staff can help provide more information about what ELD is doing to help people get their second dose.
So, I mean, my understanding, and Miriam, please feel free to jump in, is that the vaccines are really being administered at the county level.
Mm-hmm.
And so I couldn't speak to how all the different counties are addressing that. Miriam, do you have more information?
Yeah, I think again, it's really a county-driven decision around how they're scheduling and how they're doing their outreach to providers. I would say, just from looking at the question and answer box, it sounds like some people, when they did get their first vaccine, got scheduled. That could be specific to your county, though, and it could vary by provider, by the health system partner that's doing the vaccinations. So again, what our role is, to your question, Dr. Thomas, is as we have information, we are trying to share that broadly as well. Our COVID-19 page, trying to stay in close contact with OHA. I think in some instances, though, your local county public health, we've encouraged local public health to partner with CCR&Rs on outreach to providers. Information might be coming faster, so some of your local contacts, than and some lag time kind of getting back up to ELD. But we're certainly we're going to try to push out as much information as we can as soon as we have it, try to answer a lot of your questions about vaccine, including scheduling. So again, I would just say this is an effort. We don't have all of the vaccines to schedule everybody this week. So this is really going to be an effort across several weeks to reach all of the providers that are in this 1B in this priority group kind of at this time.
I would like to add that when you get your vaccine, you'll get a nice little card where it has your name on it, where you got your first dose and the date. Keep that card because it's got that spot for your second immunization, and it'll be a good reminder. And as you all mentioned, your local county public health department, if you're having trouble getting the second one, in addition to the institution that arranged your first shot, those would be your two primary contacts. And if all else fails, call 211. 211 is the Oregon Health Authority state vaccination number, 211.
Dr. Lyons. Catherine, do you have other questions?
I think there's still a few questions, both on Facebook in the chat box. Just that people said they've heard about people dying, and how did they die? And are there side effects we just don't know about?
Sadly, there's a lot of misinformation, and some of the things that I've seen on Facebook, people have shared like a picture of a woman having seizures and stuff, so forth, afterwards, and they've been investigated by doctors and so forth, and they really don't think that it's linked to the vaccine. And there really, as far as I know, there have not been any deaths in this country. I don't know about from other places, but these things just get blown out of proportion, and people that don't really have information still feel very free to share it on Facebook and on social media. And we need to do our best to sort of combat that with good information. So I'm glad that you're on the call and asking these questions. But so far, among the cases in the U.S. of the people that had the immediate life-threatening reaction, they have all recovered, and they're very rare. It's like depending on the vaccine, it's 3 or 4 for every 1 million people vaccinated.
And I would like to remind folks that here in Oregon, we're getting closer to 2,000 deaths from COVID. People die from COVID. And I'm sure if you were to ask each one of those folks beforehand, they probably would have said, well, no, I'm not at risk. I won't get it. It's not something I need to worry about. It's never affected me. And then they got it, and then they got sick, and then they got really sick. And then we lost them, and their families lost them. So the inconvenience and few side effects from this really good vaccine, I believe, are nothing compared to the chance that we could lose someone, or even if you're a young, healthy person, you got COVID and you visited your grandma and you passed it to her and she died because of it, because you didn't want to get your vaccine, I'd feel pretty bad. So we're encouraging folks to not just look at these kind of funny, odd reports that might come up on Facebook, but look at the real data and talk to your doctor, talk to the people that you trust in the healthcare system.
Yes, I haven't been able to get my vaccine yet, but I was very happy to hear that my parents, who live down in California, just got their first dose. And normally I would go down to see them at Christmas time, and I didn't go this year because I was afraid. And at that time it was really bad in California, and the governor didn't seem to want out-of-state visitors. But I'm just waiting for them to get their second shot and a couple of weeks to go by so I could go visit them.
Great. I've got a couple that go just along this vaccine questions. Says, why should somebody who's already tested positive get the vaccine?
Yeah, we don't know how long someone who's had the infection develops antibodies and is protected from getting it again, but we don't know how long that lasts. And so the best protection is to get the dose. I actually know someone who had his first shot, and then a few weeks later, before he got his second dose, he got sick, and he still went ahead and as soon as he was better, got his second shot. And he says, "I am bulletproof now." Now, some people, if they're concerned, I mean, or if you're afraid that, gosh, there's so many other people that need the vaccine and maybe I should wait a while. I mean, you could wait 90 days because that's maybe about the time that we think that your antibodies from having the infection wear off. So, if you were concerned about there not being enough shots, or if you're going to a clinic and you hear they've run out, it's like, well, it would be okay for you to step back maybe for a few weeks. But we would still recommend that. I mean, the reason that you are eligible to get a vaccine right now is because you are considered high risk, and we want to protect you. And I would get the vaccine if I were you.
Thanks. Quite a few questions about, will we need to get a vaccination every year like the flu vaccine?
That is a great question. I wish I could answer it. We don't know that yet. I mean, there's some more data now that says, because they have the people who are in the vaccine studies all last year. Now some of them it's been 7 or 8 months since they got their shot, and they're doing antibody tests on them now and saying, oh, it looks like you still have antibodies to COVID, so you would probably be protected if you were exposed. So luckily, we think it will last more than a few weeks or a few months, but it may be. But I think we will just need to wait, like a year from the time the first people got their shots to see if they're still protected. And this is certainly an area that's being studied, but at this point, it's a big unknown for all of us.
Great, thanks. Several questions about maybe who should or shouldn't be getting this. It says, if there are people who are allergic to certain medications, can they still take the vaccine? And in that same vein, maybe should people with an autoimmune disease get the vaccine?
Yeah, so in general, it depends on what kind of reaction you've had before. If you've had anaphylaxis, probably not, or certainly you should discuss it with your healthcare provider. If you've had maybe a bit of a rash, or some minor side effect, you probably can. And this goes for vaccine or foods or the medications. It generally is safe. But when you go to get your vaccine, they will ask if you have ever had these reactions before. And they will help decide, like, oh, should you go through with it or not? But for most people, it really is safe, unless they've had this anaphylaxis reaction, which is when your heart beats fast and you can't breathe, and usually they have to give you a medication to help you recover from it. Most people know if they've had that before after a vaccine. And but if you have any questions, you can talk to your own healthcare provider before you go get a vaccine, or certainly someone at the vaccine clinic will talk through these and have this discussion with you. And they don't want you to have a bad reaction either. So, they will help you sort out whether you should get the vaccine, but most people can.
Great, thanks. And this, Miriam, may actually be a question for you. There's quite a few people wondering if this eventually will be made mandatory for all licensed providers.
Yeah, thanks, Catherine. I can say OHA and Dr. Lyon or Dr. Thomas, please jump in, but OHA is not requiring anyone to get to the vaccine at this time. And so we are not requiring licensed providers. I think that we touched on this before. This may be a business decision. You can check with BOLI. We have some contact information on our FAQ page for BOLI if you need that resource. But yeah, that is not where we are at this time. Dr. Thomas or Dr. Lyon, anything else you want to add?
I like to be a little philosophical before we get to like the practical. And if you think we're doing this to protect the elderly and the vulnerable in our community, and Oregonians have struggled hard and given up a huge amount this whole last year in terms of friendships and doing things and gathering those things in life that that give us kind of the great richness and pleasure. And they've made those sacrifices to prevent more death in disease. And it's my hope that all of those that work in healthcare or that work in where they have a public interface, regular public contact, that they think about the role that they have. And if they have a reluctance to get a vaccine, that they take the time and have a serious discussion with their healthcare provider about the risks and benefits. And I would hope that if they don't want to get the vaccine, maybe they'll choose to do a different type of work that would put other people less at risk. So I doubt if we're going to get to the point. No, I think it's even with PPDs for tuberculosis. I don't believe that, and maybe Ann can comment on this, that we require that, but an employer can say, well, if you're not going to have that, then we will find a job for you that's not in contact with the public, with the general public. So I would hope that we do a good enough job communicating the safety and efficacy of the vaccine and the benefit for the public that people don't choose not to get it.
Thanks.
Yeah, I think as Dr. Lyons said, I mean, our strategy is to hope that people will do the right thing and do what they need to do to protect their community. But I think we don't want to force people to have it. I mean, one thing that does happen, for instance, before COVID, we did not require healthcare workers to get a vaccine, but if they did not want to get the vaccine, then once the flu season was here and there was, in a given hospital or in an office where they were seeing flu, those employees were asked to wear a mask all the time, which now everyone does because of COVID. But back before COVID, not everyone was wearing the mask, but those employees did. And so certainly I can imagine in healthcare settings that you will still see people wearing the face coverings for a long time to protect each other. And there's a range of strategies for hoping that people make the right decision. And right now we don't, because it is a new vaccine, we don't want to force it on anybody.
Dr. Thomas and Catherine, if it's okay, I'm wondering if you could, this is a follow-up to the getting the vaccine card when you get your first shot. Could you share a little bit more about how OHA, so the vaccination registry, and how that's tracked? So just so people know that you can get a physical card, but we are also, the healthcare providers are also recording who is getting vaccinated. A little bit more about
Yeah,
that.
we're lucky in Oregon to have one of the best immunization registries in the country. And initially it started just for children, so that if you take a child to a clinic and they get vaccinated, you would get a card, but it also goes into a central computer at OHA. And then that way, if you move or if the record gets lost, any provider who signs up to use the registry can look up, your name and date of birth and figure out you've had a shot. So really at this point, no matter where you go, if for some reason you're traveling across the state and you're in a different county when it's your time, you could go, if you're someplace else or if for some reason you can't make it to the clinic you went to the first time, anyone can look it up and see that you've had your shot, which is great because they can verify that it's you and make sure that you want to get the same vaccine because there's two in the market and you usually want to try and get your 2 doses of the same. Most of us might not remember if we had Pfizer or Moderna, but in the registry, a healthcare provider that has proper access can look through and find out which one you had.
Tammy, I know you want to have a little bit of time to go over some of the other things, so maybe a couple more questions here. There was a question that's coming in from the Facebook group. It says, what happens if you don't go back for a second dose?
There would be a 50% chance that the shot doesn't work for you. So at that point, you decreased your odds of getting COVID a little bit, but probably not enough. And for instance, if you were exposed at work, if there was a case in a child at work, you would have to still go into the quarantine and and stay home for at least 10 days because the shot is not protective enough after 1 dose.
Thanks. And maybe one other one here, just there's a lot of likes on this one. It said, if you have an anaphylactic reaction, even if you have the treatment to stop the reaction, what stops the reaction from happening again soon after?
Because the reaction just doesn't last that long, and usually you'll be given the medicine until you're better, and they will observe you. You're not just going to get a shot and say, hey, go ahead, drive home, it'll be fine. They're going to watch you and make sure you're okay, and it doesn't usually keep happening again.
Thanks. Tammy, do you want to get to your other slides here?
I think that we need to think we've done a good job, got the vaccine questions covered, but we don't want to miss out on talking about the other amendments so we can answer questions that may come from those. So I'm going to try to zip through these pretty quick in honor of your time this evening. So this is a change that we made in the amendments, but we actually put out a question on our FAQ a couple months ago when the temperature started dropping in Oregon. So if you are experiencing inclement weather, you can conduct drop off and pickup inside your program. There's some requirements that need to be followed. The parent or adult that's entering must have a facial covering on. You need to make sure that you have enough space that everyone can maintain social distancing of 6 feet and remain in the entry, not actually entering into the childcare area. And so you really want to look at the size of your home and the size of your entry. That may mean that you only have space for one family at a time. And you want to make sure that you're not using any fans in the drop-off pickup area, because that just spreads the air and any aerosols that are happening from people coming in. And Catherine, I'm going to zip through these and then we'll go back and catch questions on it, okay?
Sounds good. Thank you.
Okay. So we put in some clarifications about additional adults in the program because we were getting a lot of questions like, can I have a photographer come in and take pictures for school pictures? Or can I have a music lady come and do a special class? So we put in some additional clarifications that those additional adults really need to be very limited and need to be focused on the education of the child or the special needs that a child may have. So people such as tutors, special eds, special education instructors, or children that are on individualized education plans can have their services provided. And you can also use volunteers and practicum students. But if you're going to have volunteers and practicum students, they need to be assigned to just one stable group, and they can't be transferring between groups. So if you're a certified family and you're keeping your childcare split up into 2 stable groups, you need to make sure that you're keeping them just assigned to one group so that you don't have them transferring back and forth. And then with volunteers and practicum students, you want to make sure that you're limiting them to one individual within the stable group at a time. So you're really keeping control on how many extra adults you're allowing in your program. And contracted services for things such as gymnastics and music just really aren't permitted at this time because we need to, like I said, limit the number of individuals that are in the home. And then this was a little bit confusing for some people who were looking at the amendments document because it looked like there were strike throughs to all the sections that talked about group size and stable groups. And actually what was deleted was the section that referred to counties in a baseline phase. In Oregon, we've changed our county approach, so it's not in phases now, but it's in, I'm not thinking of the word. Not hazard level. Miriam, can you help me with the risk level? Thank you. We've changed our approach in the state to having risk levels. So because counties won't be going back to baseline, we did remove that section of the guidelines. Okay, so in the personal protective equipment section, the prior guidelines thought that shields and masks and face masks were equal, but what we're now realizing from the CDC and also from OHA is that face shields aren't seen as equal to face coverings or face masks. They're not as effective at limiting the release of the aerosols that can go around the shield. So we've removed all references to face shields. And while face masks are preferred face shields are not prohibited in certain circumstances when it's really necessary. For example, I received a question from a childcare center yesterday whose bus driver was having a hard time wearing a mask because he wore glasses and his eyes were fogging up while he was driving. So while he's driving, he's choosing to use a face shield so that he can keep his eyes cleared. We also know that there's sometimes with some children that maybe have a learning disability, a developmental delay, where seeing that face and that face shield is really a better learning experience for that child. So even though we've taken out the references, they aren't prohibited, they're just not preferred. And then the other big change in the PPE section was the removal of the wording around outer layers. It used to say that outer layers were required if you were a floater going between different groups, if you were doing health checks in the morning, or if you were feeding infants. But that requirement has been removed now, so you no longer have to be having a clean outer layer on. Okay. In the daily activities section, there were really just two small changes made. We put in a clarification that the space that needed to be placed between napping children also did include cribs. It was intended to have cribs in there, but it was just a word that got missed. And then in the cleaning and sanitizing section of the daily activities, we just put in some clarification when it talks about cleaning and sanitizing classroom materials between uses. It really means by a stable group. So it's not that every time one child touches the toy and then the next child touches the toy, you have to pick up the toy and clean it and sanitize it real quick if they're as part of the same stable group. But you do want to clean them if the stable groups are going to be changing as the toys become dirty. So if you see any toys going in a child's mouth, you want to grab that one and clean it. And then they also need to be cleaned at least daily. So we just did some clarification on this one to bring it more in line with the chart that's in the cleaning section. Okay. And then our last big change was around transportation. And the part that really affects family childcare is the second bullet down that talks about home-based childcare providers. The previous guidelines said that children need to be maintained 3 feet apart when transportation was occurring. And we recognize that when you have a family vehicle or your van, that having 3 feet distance between children is really quite challenging. So now it's encouraged, but it's not required. The other big change that happened in the transportation section is the third bullet. The previous information indicated that the car seats and seat belts needed to be sanitized and disinfected in between uses. But we received information that indicated that that can actually erode the ability of the car seat and the safety system to work properly. So the car seats and seat belts should only be cleaned with a mild detergent as opposed to a stronger sanitizer. And those are the big, none of the changes were all that big in the amendments. The larger ones we went through last week around exclusion and quarantine. Catherine, are there any questions on these slides?
Only one so far, and there was a question about, they understand no fans in an entryway, but are air purifiers in the entry okay?
Oh, you know what? I am not an expert on air purifiers. Does anybody on the panel know whether those blow air around similar to a fan?
Hi Tammy. I do believe that there are like motors on those that would actually blow, and they don't. And unless there's, I would assume, unless there's a window open or some other kind of ventilation, that wouldn't, that wouldn't prevent any kind of transmission. So
Yeah. I hear you saying that you think that they're similar to a fan and should not be used in the entry.
Right. I mean, and I understand that people are using air purifiers to try and prevent transmission, right? And I don't think I don't think it's the same.
Yeah, it's a good question. I'm not sure if we know enough about this one, so I'm going to have to do a little bit more research with our colleagues at Oregon Health Authority. And then Catherine, if the person who asked that question, if they can put their email into the question, I'd be happy to follow up with them. Or if it seems to be a question that we're getting a lot of, I can also put it in our FAQ on our website.
Thanks. That's it at the moment, I think, about any of those.
Okay. So look at that, it's 7:02 and we almost hit our time. So I just wanted to review again, if you weren't on 2 weeks ago, we have updated our website FAQ on the vaccination information. We have a lot of new questions posted on there. So if things that that Dr. Thomas and Dr. Lyon shared today are still a little fuzzy, those questions are on our FAQ and you can read them and follow up with us if you have further questions. We also have updated questions on the amended guidelines and have gone through and got everything in order now. On our website, we do have updated technical assistance documents that have been updated and posted so that they're available to help you and support you as you implement the changes. And if you have any further questions, please reach out to your licensing specialist, or you can also email us at the provider contact email. Miriam Cecilia, who just jumped on the screen, is actually the one who answers those questions. And so if you come up with things later in the day, please don't hesitate to reach out to us. And thank you, panel members, Dr. Thomas and Dr. Lyon, for taking the time with us tonight. We appreciate all your expertise that you've been able to share. And we'll see you next time. Thanks for joining us.
Tammy, just one quick comment. I know we didn't maybe get to all of the couple questions left in the chat box related to vaccines. So just please stay tuned to that FAQ page that Tammy mentioned, because we will take those from the Q&A box this evening, and we'll work with OHA to get answers to those on our FAQ page.
Great. Thank you, everyone. Have a great evening.
Bye.